The women that it affects are childbearing age or upper 30s that it usually affects, and it's mainly the skin form where the skin gets real hard, because that's what scleroderma is, the hardening of the skin, the tissues of the skin. The blood vessels die and reconnect, and then the tissues start building and it gets real hard. And he had that around his stomach starting. It's just a darkening. It just gets browner and browner, and it's just the scar tissue forming. But that's what it does to the organs, and that's what it does to the joints. So he's arthritic. I mean, Chip, can you make a fist? And, you know, he can make, that's huge when he could only do this just a few months ago. And it's cold out, so his joints are stiffer. He had lost all of his shoulder movement. He could not raise his arms straight up or his hands back.
Oh, my.
And he goes to physical therapy, and he goes to occupational therapy. Once a week we go to Driscoll Children's Hospital here to help with just keeping what's moving. His toes could not bend, and all this is documented with the OT and PT that we go to, because we did marble exercises, just trying to grab the marbles with the toes to keep them moving. And his ankles would, if you've ever seen anyone arthritic, they get real shiny and red and swollen and hot to the touch. April of 2006, we went up to Houston to see a pediatrician, a rheumatologist who specializes in, who just specializes in rheumatoid diseases in children. We did not know what he had. We just knew that from the fall of 2006, he ran a fever a couple of days. His face was increasingly turning white, almost like he was anemic. And his stomach hurt all the time. They kept telling us that it was allergies, that it was a halo effect. And when you think about it, it's understandable. Most doctors will never in their lifetime, especially pediatricians, ever see this disease. So they didn't have a clue what they were looking at. We did have him tested in December, and I believe it was January of 2006, for anemia and leukemia, because those were the only diseases we knew could make him real pale like he was. And his CDCs came back normal. Then in, I guess, beginning of April, he was taking sign language classes. And I bent down to bend his finger in the position of one of the letters, and he just screamed out in pain. And that's when I realized he could only move his fingers about this much. And he said his knees, he couldn't sit on his knees anymore either. He had just never told us because he thought that was just the way God wanted him to be. He doesn't complain much. So I went home and we took him, and that's when we drove him up to Houston, Texas Children's Hospital. And we saw the specialist, and we thought we would go in there and she'd say, oh, it's arthritis, this is what we do, and we would leave. And instead, we were there the entire day. She ran x-rays and labs and just respiratory exams, and we came back the following Monday for an upper GI. And then she told us that he had what's called systemic scleroderma. It's an autoimmune disease that there's no cure for, and the form that he has affects all the joints for the first couple of years, and then around the second or third year it starts affecting the major organs: esophagus, heart, lungs, kidneys.
And what starts it? Do they know?
They don't know. They know that there's probably, they estimate, about 1 in 1 million it affects in children. So there's not the numbers to do the research. The Texas children put him on about 7 different pills. Because he was getting vasculitis because of the circulation. He had, I'm not sure if you're familiar with Raynaud's. He could, anything cold, the blood vessels would not get to the extremities fast enough, so he would turn stark white. I mean, like white like this. It was just, it was scary. There would be no color. And so he started getting on the sides of each big toe big ulcers that were oozing because of lack of blood flow. So they had him on heart medicine. It was about, I wish I could remember all, but they put him on methotrexate, which is chemotherapy, and prednisone, but there were like 7 different pills for him. And at the time we were scared, so you leave and you do what they tell you to do, because you're just, that's what you do.
They're the experts,
They're
right?
the experts, and they're telling you that what they're trying to do is crash his immune system because they've classified this as an autoimmune disease. So they're taking him and they're trying to bring his cells down to where they can't function at all, so that everything will stop in hopes that the disease won't be able to produce.
Oh.
So that's where we were at, and you know, he just laid. We had to come to a point where we had to decide, and he doesn't know any of this. We don't usually talk, but that's okay. I mean, he's fine now, so it's okay to talk like this. Where if he only had a day or two left, that he wouldn't want to live laying on the couch feeling sick. So we started looking into some other things. And through the road back, it's a foundation that a doctor had developed. He was trying to find a cure for rheumatoid, and in doing that he discovered that by pumping people with strong doses of antibiotics that he could somehow put in remission scleroderma. And so we started reading about this, and the only doctor that we could find that would treat him was in Iowa. So we raised the money to travel. We had an awesome Boy Scout troop. Raised the money for us, and we traveled in July to, and at this point we've taken him off the prednisone and the chemo. He started having what they call psychotic episodes on the prednisone. I didn't realize, because, you know, everything's happening so fast. We're trying to research the medicines, but as we're pumping them into him, he's having weird things he's just going through. And so we took him to Driscoll because I was scared. I didn't quite understand what was happening. And because of the prednisone and all the chemicals that were in his body from the drugs, he was really having these episodes of depression, and they were a little scary. They took him, we dwindled him off the prednisone, we stopped the methotrexate completely, the chemo, and then we started taking him off some of the other drugs. So at this point we don't have really a doctor, and we start talking to the doctor in Iowa, and I have his physical therapist and his occupational therapist that are working with us. And he helped us to take him off all of the medicine. We drove up to Iowa, started the IV treatment, came home. He was better. His joints were better. He seemed better. Our primary care physician took the children on, and at that time, because he said, I'm amazed, they're your children. If this is what you want to do, we'll do it. And the next month we did 1 day worth of antibiotic. But when we were there, the doctor in Iowa, Dr. Sennett, said that because he was having so much trouble with his stomach, that it was probably from the colon, most likely the scleroderma affecting the soft tissue of the colon, which would upset the entire body. And he asked if we could treat him aggressively. So instead of working him up in doses and stopping at about 300 milligrams of the antibiotic, clindamycin, Cleocin, it's an antibiotic. He gave Bradley 600 milligrams twice a day, which is a large dose for a child, but he was at that point where he felt he needed to be more aggressive with him. We brought him back home. The physical therapist said, wow, he is better. The next month, he started going downhill after about the 3rd or 4th week. Did the antibiotic treatment. He was a little bit better, but not a lot, and we were really worried because his stomach was starting to bother him uncontrollably again. And he is, at this time, he's on vascular medicine. It's heart medicine for the Raynaud's, for the turning of the fingers and the vasculitis that he's got. And he's on the minocycline, which is an antibiotic, twice a day, 50 milligrams. And it's amazing. A friend brought us here because he was in a wheelchair. His legs would get real heavy where he could not walk, and they would hurt. So it was right before it was Fall Festival. We went to a church Fall Festival. And, you know, kids, they want to run. Yeah. So we knew he was hurting because he wouldn't run to the games. We would have to wheelchair him and lift him up and let him play and then sit him back down.